We were talking before a little bit about cancer.
Yeah.
And what do you do? How do you take that approach? I mean, freezing your eggs for cancer patients. We were talking a little bit about that. How do you do that?
Well, the big thing now, the reason why we think it's so important now is because there's this brand new technique called vitrification. Vitrification, yes, beginning with a V. And it's this very high-tech, cool thing where we drop the temperatures, I think this is appropriate for today, drop the temperature of the egg super, super rapidly from, body temperature, which is around, what are we at? 37 degrees centigrade down to negative 196 degrees
That just
centigrade.
sounds so cold.
Yes.
How quickly is that?
Within milliseconds.
Oh
So it's so fast, you can't form ice crystals. And ice crystals are what used to harm the eggs when we froze them in the old days. The ice crystals, you can see them, they're very sharp. In the delicate egg, they could disrupt the structures. So this technology has completely revolutionized egg freezing.
Oh
She's
my
like
gosh.
the science techno one. See, it's funny. You asked that question, I was going to come at it in a completely different way. So now I will. So the way we get to these patients, and eventually perhaps they vitrify their eggs, is that they get a cancer diagnosis. A lot of times, the patients that we're dealing with, it's breast cancer, it could be leukemia, lymphoma. But the wonderful news is that treatment in oncology has really changed the way people look at the cancer diagnosis, and that it's no longer a death sentence. For a lot of these cancers, they're going to get treated and they're going to beat it. They will be cured. And a lot of these cancers happen in women who are of childbearing age. So as our technology got better, we got better at freezing eggs. On the clinical side of things, the reproductive endocrinologist, the oncologist said, well, wait a second, these women are going to be alive to have their families. These 16-year-olds with Hodgkin's, they may be alive to have babies, where in the past that wasn't the case. But the chemotherapy is gonadotoxic. The gonads, of course, ovaries and testicles.
Sure.
Chemotherapy is highly gonadotoxic, and that would render a lot of patients infertile. So what we do when they come to us is that we will take them through the egg freezing process, where we stimulate their ovaries to make a lot of eggs in one cycle, not just one. And then we harvest them surgically. We remove them from the ovaries by a 10-minute procedure. It's invasive, but barely. It's just a needle-guided aspiration, transvaginal aspiration of the oocytes. Basically what that means is the patient goes to sleep. We use a transvaginal ultrasound probe with a needle guide attached. It goes through the vagina right into the ovary. And we're looking at this on an ultrasound machine. And we aspirate the fluid out, and then the microscopic eggs come with it, come with this fluid that surrounds the eggs. We give that to the embryologist. The embryologist looks at the eggs and counts them, and then we freeze them. Patients can come back at any time, 10 years, 5 years, 20 years. I mean, the shelf life on a vitrified egg is indefinite.
Yeah.
How amazing is this?
You were explaining that extremely well. In my brain, I was seeing exactly...
visualizing this entire thing.
Yeah.
Amazing.
Yeah.
I know we visualized the same thing because we were in each other's head.
Yeah, we did.
I know that.
It's like, I kind of want to have this done.
Oh, do you? You should.
Anthony, we're working on that, but we haven't got that
that you
perfected
do.
yet.
Okay.
But what we need you guys to do is to help us get the word out, because the tough thing about this, even though having a family for cancer survivors is one of the most important quality of life issues post-cancer, the issue is that well over 50% of cancer patients are not even getting counseling about fertility preservation. That's a really, really tough thing. And so that's why we're here, because we feel like, you guys have the ability to communicate.
And I'm going to express this everywhere. I'm going to just say that this is amazing.
Yeah.
We are so excited because look what you guys can do.
Yeah, and I think it's not just us. The American Society for Clinical Oncology, it's called ASCO. There is a recommendation from them that states any woman any woman or man of reproductive age. Now it's a little bit different for guys because, as you know, they can reproduce, sort of throughout
all the
life.
time. Yeah.
Should be referred to for reproductive, counseling for fertility preservation. Just counseling. It doesn't work for everybody.
Yeah.
But again, it's what Serena comes back to, the information and the education in someone who is, feels as vulnerable as our patients do, who have cancer, who have infertility, can be so helpful and so empowering. And then they take that information and they make a decision that works for them.
Well, when your doctor says, let's talk about freezing your eggs because you might want to have kids after we cure your cancer, they're basically telling you, we think you're going to survive. We think we need to talk about this because you're going to survive your cancer. It's a very positive, empowering conversation to have, even for the patients who ultimately decide, this is not for me. Even our patients that say, I don't think I'm going to freeze, they all still say thank you. We really, really appreciate the information.
Would an oncologist even think about recommending that? Or would it be an oncologist that you would have to know, you'd have to have worked with in the past?
Well, that's what we're working on. It's tough because the fields are so highly technical and have never really worked together before. So we're really breaking new ground here.
What a great question.
It is.
That's an excellent
we are trying
question.
now. We are in the middle of that education of getting out there. There is a whole subspecialty in our subspecialty, a sub-subspecialty, if you will, called oncofertility. And so we are trying to get the message out there to oncology groups to say, don't forget, do what now ASCO is recommending, and give your patients that. It's like Serena said, it gives them hope.
Hope, exactly.
You are
That's what I
going
was-
to survive.
Hope, yeah.
So now you're 17, but when you're 28, and this is important, the egg freezing is so that you have that opportunity to have a baby with your own eggs. We could always use donor eggs.
Yeah.
A patient that does not have the ability to produce eggs on her own, whether it's premature menopause or chemotherapy-induced
Or
menopause,
she had her ovaries removed for whatever reason.
can use eggs from a donor. And that's just, again, like I said before, there's so many permutations, so many things.
But
you
I
can do to
think you
help.
guys are just as important as the oncologist, honestly. The oncologists are super specialized, and yes, they should be talking, that's what ASCO says, they should be talking with all their patients about fertility preservation. But I think you guys are just as important, just the fact that you know and that you're going to tell people. We want primary care doctors to know. We want the man and the woman on the street to know, hey, this is something that people should be thinking about. So
everybody needs to know.
Yeah,
Exactly.
we don't want there to be any stigma. It's not something special. It's just something to think about for every cancer patient.
So everybody listening, cancer or not, just any issues, any trouble, anything at all, just look at that website. Dr. Deb, Dr. Serena, why don't you give that website again? Look at that website.
It's www.sbivf.com.